Hello everyone, and welcome back to BananaLyfe. Today, we're diving into a topic that impacts millions of lives worldwide: how to stop smoking. Quitting smoking is one of the best decisions you can make for your health, but it's also one of the most challenging. Nicotine is a highly addictive substance, and the habit of smoking can become deeply ingrained in daily routines and social interactions. However, with the right strategies, support, and determination, you can overcome this addiction and lead a healthier, smoke-free life. Let's explore effective methods to stop smoking and practical tips to help you stay smoke-free for good. First, let's discuss why quitting smoking is so crucial for your health. Smoking is the leading cause of preventable death worldwide, linked to a variety of serious health conditions such as lung cancer, heart disease, stroke, and chronic obstructive pulmonary disease (COPD). It can also cause other cancers, including those of the mouth, throat, esophagus, and bladder. Beyond these life-threatening conditions, smoking can also lead to numerous other health issues, such as respiratory infections, reduced immune function, decreased sense of taste and smell, and premature aging of the skin. The good news is that when you quit smoking, your body begins to repair itself almost immediately. Within 20 minutes of your last cigarette, your heart rate and blood pressure drop to normal levels. Within 12 hours, the carbon monoxide levels in your blood decrease, allowing your blood to carry more oxygen. As the days and weeks pass, your lung function improves, and your risk of heart attack begins to drop. Over time, your risk of smoking-related diseases continues to decrease, and your overall health improves significantly. Now that we understand the importance of quitting smoking, let's talk about how to actually do it. One of the first steps to quitting smoking is to make a firm decision to quit. This might seem obvious, but having a strong commitment to quitting is crucial. Take some time to think about your reasons for quitting. Maybe you want to improve your health, save money, set a good example for your children, or simply feel better overall. Write down your reasons and keep them somewhere visible, so you can remind yourself of them whenever you feel tempted to smoke. Setting a quit date can also be helpful. Choose a date within the next 2 weeks, so you have enough time to prepare without losing motivation. Mark this date on your calendar and make it a personal milestone. Once you've decided to quit and set a date, it's time to prepare for the challenges ahead. One of the biggest challenges of quitting smoking is dealing with nicotine withdrawal. Nicotine is a highly addictive substance, and when you stop using it, your body goes through withdrawal, which can cause symptoms such as irritability, anxiety, difficulty concentrating, increased appetite, and cravings for cigarettes. These symptoms can be intense, but they are temporary and typically peak within the first few days to weeks of quitting. There are several strategies to help manage withdrawal symptoms and make the quitting process more manageable. One effective approach is to use nicotine replacement therapy (NRT). NRT provides your body with a low dose of nicotine without the harmful chemicals found in cigarettes. This can help reduce withdrawal symptoms and cravings, making it easier to focus on breaking the habit of smoking. NRT comes in various forms, including patches, gum, lozenges, nasal spray, and inhalers. Talk to your healthcare provider about which form of NRT might be best for you. Another option is prescription medications, such as bupropion, Zyban, and varenicline, Chantix. These medications can help reduce cravings and withdrawal symptoms by affecting the brain's response to nicotine. They are typically used for a limited time and should be taken under the supervision of a healthcare provider. Behavioral therapy is also an important component of quitting smoking. This type of therapy helps you identify and change the behaviors and thought patterns that are associated with smoking. A trained therapist can work with you to develop coping strategies for dealing with triggers and stressors that might lead you to smoke. Many people find that combining behavioral therapy with NRT or medication is more effective than using either approach alone. In addition to these treatments, there are several self-help strategies that can support your efforts to quit smoking. One helpful technique is to identify your smoking triggers and develop a plan to avoid or cope with them. Common triggers include stress, certain social situations, drinking alcohol, or even certain times of the day. For example, if you typically smoke during your morning coffee break, try changing your routine by going for a walk or doing a short exercise session instead. If stress is a major trigger, consider incorporating stress-reducing activities into your daily routine, such as meditation, deep breathing exercises, or yoga. Another useful strategy is to keep your hands and mouth busy. Many people find that the physical act of smoking is as addictive as the nicotine itself. Chewing gum, sucking on hard candy, or using a straw to mimic the motion of smoking can help satisfy the oral fixation. Keeping your hands occupied with a stress ball, fidget spinner, or other small object can also be helpful. Staying connected with a support network is crucial when trying to quit smoking. Let your friends and family know that you are trying to quit and ask for their support. They can provide encouragement, help you stay accountable, and offer a listening ear when you're struggling. Joining a support group, either in person or online, can also be beneficial. Sharing your experiences and hearing from others who are going through the same process can provide motivation and practical tips. It's also important to create a smoke-free environment. Remove all cigarettes, lighters, ashtrays, and any other smoking-related items from your home, car, and workplace. Clean your house and car to get rid of the smell of smoke, which can be a trigger. Consider making your home a smoke-free zone and asking visitors to refrain from smoking inside. One of the biggest challenges of quitting smoking is dealing with cravings. Cravings are intense urges to smoke that can be triggered by various factors such as stress, social situations, or even just the sight of a cigarette. While cravings can be strong, they typically last only a few minutes. Developing strategies to cope with cravings can help you resist the urge to smoke. One effective method is the 4Ds technique: delay, distract, deep breathe, and drink water. When a craving hits, delay acting on it by reminding yourself that it will pass. Distract yourself by engaging in a different activity, such as going for a walk, calling a friend, or working on a hobby. Practice deep breathing exercises to help calm your mind and body. Drinking water can also help, as it gives you something to do and helps flush nicotine and other toxins out of your system. Physical activity can be a great way to reduce cravings and manage stress. Exercise releases endorphins, which are natural mood lifters, and can help reduce anxiety and improve your overall well-being. Even short bursts of activity, such as a brisk walk or a few minutes of stretching, can make a difference. Finding an exercise routine that you enjoy can also provide a healthy distraction and a sense of accomplishment. Keeping a quit smoking journal can be a helpful tool for tracking your progress and staying motivated. Write down your reasons for quitting, your quit date, and any challenges or successes you experience along the way. Reflecting on your journey can provide insight into your triggers and help you develop strategies for overcoming them. It can also serve as a reminder of how far you've come and the positive changes you've made in your life. Rewarding yourself for reaching milestones can be a powerful motivator. Quitting smoking is a significant achievement, and it's important to recognize and celebrate your progress. Set small, achievable goals, such as 1 day, 1 week, or 1 month without smoking, and reward yourself with something special when you reach them. This could be something simple, like treating yourself to a favorite meal, buying a new book, or taking a day trip to a place you enjoy. Positive reinforcement can help reinforce your commitment to staying smoke-free. It's also important to address any underlying issues that may have contributed to your smoking habit. For some people, smoking is a way to cope with stress, anxiety, depression, or other emotional challenges. Seeking support from a mental health professional can help you develop healthier coping mechanisms and address any underlying issues that may be making it harder to quit smoking. Remember that quitting smoking is a process, and it's normal to experience setbacks along the way. If you slip up and have a cigarette, don't be too hard on yourself. Instead, view it as a learning experience and an opportunity to recommit to your goal of quitting. Identify what triggered the slip-up and develop a plan to avoid or cope with that trigger in the future. It's important to stay positive and focused on your long-term goal of living a smoke-free life. If you're finding it particularly difficult to quit smoking on your own, consider seeking additional support from a healthcare professional. Your doctor can provide personalized advice, recommend appropriate treatments, and monitor your progress. They can also connect you with resources such as smoking cessation programs or support groups. In conclusion, quitting smoking is one of the best decisions you can make for your health. While it may be challenging, the benefits of quitting far outweigh the difficulties. By making a firm commitment to quit, preparing for the challenges ahead, and utilizing a combination of strategies and support, you can successfully overcome nicotine addiction and enjoy a healthier, smoke-free life. Remember that you are not alone in this journey, and there are many resources and people available to support you. Thank you for joining me today on BananaLyfe to discuss how to stop smoking. If you found this video informative and helpful, please give it a thumbs up and subscribe to our channel for more health and wellness tips. Share this video with anyone you know who might be struggling to quit smoking, and leave a comment below with your own tips and experiences. Together, we can create a healthier, smoke-free world. Take care, stay strong, and remember that every step you take towards quitting is a step towards a healthier, happier life.